So as I said earlier, we ran a workforce survey and spread kind of wide and far across the SEND system, all sectors, over the summer, and asked what the sector you might like to hear more about through various mediums, so webinars. We also do that e-learning, our national events, and joint commissioning is the kind of perennial issue that comes up, both when we're in local areas, but also through that workforce survey and kind of national conversations. Personally, I think joint commissioning is a kind of catch-all term. I think, and I know that as we're about to hear this morning, there's a lot that sits underneath joint commissioning. It is not just a one-off event or a one-off bit of work. It is all encompassing. So joint commissioning is one of the things that we wanted to focus on, and therefore this morning is a chance for you to hear from 3 areas that are doing something well and effective. They're all at different kind of points on that journey, so we're going to hear more about that, but under that catch-all of joint commissioning, and what CDC does most, and what our bread and butter is kind of sharing practice and helping people understand and replicate that practice. So this is about helping you do that. We will also, at the end of the morning, so we're with you until 12, we'll share some, and whoever's not on mute, if you could go on mute, because I hear a bit of feedback. Better, thank you. We'll share some joint commissioning resources that CDC have developed over the last few years, so there'll be links. We'll also share the slides with you afterwards. And as I said, we're recording, so this will be up on our website, and we could share the link to that with you so that you can watch it again if you're so inclined, or share it with any colleagues. So anyone who hasn't already, pop your name and your role in the chat. That's great. But I'm gonna hand over to Tracy Fisher from Portsmouth, who has been here since 10 o'clock, ready and waiting. So Tracy, we'll move the slides on if you just give us a heads up when you want us to do that. And if everyone else, while we're presenting, if you turn your cameras off, that might be easier in terms of focusing on the slides. Okay.
Thank you. Good morning, everyone. My name's Tracy Fisher. I'm Children's Complex Care Manager and Designated Clinical Officer for SEND for 0 to 25 in Health and Care Portsmouth, which is part of the Hampshire and Isle of Wight Integrated Care Board. I wanted to share with you this morning Portsmouth experience and my experience. I am quite new to this, so I've been in post around about 20 months. Prior to that, my background is nursing and specialist health visiting for children with complex disabilities. So I wanted to share with you our way of working in Portsmouth, how it's currently working. And as I say, it really is from my viewpoint. So sort of taking it back to the basics and sort of where I'm at and my understanding of it, and the projects that we're working on. And I see this morning that we do have lots of designated clinical officers here. So although I was going to do a big spiel over what a DCO is, I feel that that'd be slightly wasted because the amount of people here that are already in that role. But just to say, a designated clinical officer plays a key role in implementing and embedding the SEND reforms, and in supporting joined up working between health services, local authorities and other SEND partners. And I feel a key part of the role is around the advocate and best interests for our families and our children and young people, and also that we're in a very fortunate position to be curious, to be that professional asking those questions and having that oversight to see what's really happening out there, and as I say, to be curious and to ask the questions. So within the city, we are a small unitary authority. Portsmouth City is committed to ensuring that children and young people have the very best access to that timely identification of needs, and a responsive support in a strong partnership working across the system is key to how we see achieving our goals. Our integrated children's commissioning team has responsibilities across the Integrated Care Board, and also within the local authority. So right the way from our Director of Children's Services through to myself as the Complex Care Manager and DCO, we have roles and responsibilities both within our local authority and within our Integrated Care Board. We also have a Section 75 in place with our health colleagues, which also enables that more joined up working and sharing of information. And on there is just our commissioning team structure. So you can see the links between our our local authority and also our integrated care board and how that works. And this really helps with building those relationships and really finding ways to work more integrated in a system that is very complicated. Thank you. So joint commissioning beyond sharing the budget in Portsmouth. We aim to be outcome focused. We aim to empower people to have a choice and control in their lives and over their care and support. That it's a challenge to the status quo, that we're meeting that population needs by saying, you know, not saying this is how we've always done it, so this is how we're going to continue to do it. So to look at what the so what is, to be outcome focused and really understand what their needs are. So sorry, I'm going to do an example of this for me is around autism and autism diagnosis and the long wait list. So you could have a child that's waiting up to 3 years for a diagnosis. They will be on a wait list. They will not necessarily have any contact with any professionals. They will not know where they are on that wait list, but they may be sitting and waiting. And during this time, their needs are not being met. Autism diagnostic services are extremely expensive, and it's very, very tempting when you have high numbers on a waiting list to go, we absolutely need to throw money at this because we need to invest in this because the needs of our children are not being met and we need to have that diagnosis. And I guess the challenge to the status quo is something that we have done in Portsmouth, and I will talk a little bit more about this later, is around neurodiversity and looking at and identifying the needs of our children, not taking away from having a diagnostic service, but looking at that early intervention and how we can meet the needs of our children and young people with a needs-led service that will provide that support in a timely manner when they need it and not when they're waiting for that diagnosis to come and sitting on a wait list. And looking at how we can work together across the whole system to provide a service that meets their outcomes at a much earlier time. And as I say, but not taking away from the diagnosis if that's absolutely needed, but other things we can put in place prior to that. It enables a sharing of resources, so we can share procurement, IT, personnel. IT is always a challenge. We know we have different systems across health education and social care. They do not always talk to each other, but this is where personnel can come in and be really crucial and useful. It can explore a different way to do things, not just sort of go with the flow and how we've always done it. It can promote new ways of working, so it can be underpinned by the principles of that co-production and personalisation. You know, how can we work more effectively together? How can we have that two-way interaction with others to really explore how we can deliver this differently to fit within our budgets? And what it aims to do is focus on the best offers and to commission a few. So that good commissioning that's person-centred and focuses on the outcome that the people are saying that matter to them. So what are the true needs of our children and young people? What matters to them and their families? And we aim to, within that, to empower that choice and control and to give them back ownership of their care and support. Next slide, please. Thank you. So for us, what has helped? It's taking responsibility and owning the narrative, understanding the perspective from other parts of the system. Relational practice has been really key to us being able to develop really meaningful relationships with our local authority colleagues across our provider services, and really taking the time to do that. And what has helped is accepting that it takes time. All of these things are not a quick fix. As I say, I use the example of a neurodiversity pathway that we've been developing. The conversations for the neurodiversity pathway started about 10 years ago. The co-production did start with a very blank page of the outcome. What's the outcome we want to achieve for our children? and young people, and how do we get there? And it's taken 5 years to sort of get to the point where we've actually now have an ND team in place that is starting to deliver that service. So as I say, you know, it's accepting that you have to have a very clear story, that you need to own that narrative, that it takes time. The sharing of resources and ideas I've already mentioned. It's more cost effective to share those resources, and also it's really beneficial to explore what you want to achieve from a different angle and learn the different cultures across the system, there is all that slight variation and things that we need to learn about each other. Be bold and brave in that decision making, is that sometimes you're going to have challenges and decisions that are going to need to be made, and it can be really difficult to be to sort of take that step and be able to do that. My terrible drawing in the corner really does feel sometimes commissioning is somewhere between a rock and a hard place, and that you're swinging between the two. But if you keep chipping away at it and developing those really meaningful relationships, it really does start to pay off with having that one voice, that one language, enabling that co-production to increase and to be developed, and really having those open relationships that enable that two-way conversation and really working together. It's also recognising that there are differences between health education and social care, and that actually it's what can we work together, you know, where can we, what things do we absolutely statutory responses that we need to respond to, you know, what are the national drivers that are keeping us, that we also have to report into it and to manage, and then actually where can we join up together, where can we really make a difference and improve what's going on. Understand the landscape, enable us to have that shared and agreed solutions by designing and delivering services that meet care and support needs and achieve outcomes that the people want. Some of the challenges that we've had is around that relational practice. So relationships right the way from senior management need to be cohesive and integrated, but also this can be barriers to building those relationships. Some of that can be around actually, certainly, I mean, I think through COVID and through this working on teams and everybody adjusting to a new way of working, and now coming out of that pandemic and moving back into a different way of working again, because we're not ever, I don't think, going to be quite back to where we were pre-pandemic, but equally we don't want to be back in that sort of lockdown situation and everything being managed on teams. That can be really difficult to have that relational, build that relational practice. If it doesn't fit someone's agenda, or it doesn't fit that service's agenda, then it can be very difficult to get that engagement. And I think what can help this is owning that narrative, and really being clear on what the outcomes are and how those outcomes are absolutely meeting the service users' needs. So we need to find a way in, and I think this is where, if we build really good relationships, then we can get that engagement from others, that whole system approach at every level, so right from, you know, as I say, from your directors all the way down to practitioners, can really help with this. The narrow-minded thinking and fear of change sometimes, and certainly I've been in conversations where commissioners are seen as money people, or somebody who's coming along to cut budgets or to change how they deliver a service, and seeing it as a barrier rather than seeing it as a strong working relationship, and looking at it from a pure quantitative data, so a KPI to be achieved, which absolutely need to be there, and we need to have quantitative data, but alongside that we need to be looking at that quality of care and how we are truly achieving outcomes for our children, and for them enabled to move into adulthood and to have a fulfilling and productive life and to meet their aspirations. The working in a co-located or joint way, sometimes some teams can be co-located but actually don't really work together in an integrated way. So you could all be in the same office and have conversations and know people, but are actually not sharing that information or working on projects together. And this can be, again, with that sort of, because of the pressures of work, because of that blurring of responsibilities, and not really having that message right the way through the system of working together, it can be a real challenge. There can be a mismatch in priorities. All services have different priorities, and it's about how can we align those priorities, reduce that negativity and reduce that focusing on money. We absolutely need to look at overspend, and certainly now with the current climate and cost of living crisis, those money pinch points are going to get even tighter. So we really do need to be looking at what have we got within our systems, what could be working, what could work together, how could we work together more effectively, and reduce those inequalities and improve our outcomes for our children across the system. As I said, we can be wedged between that choice and commission service. So is there something within that already commission service that we can do differently rather than have to spend more? Fully appreciate that we are a small unitary authority, and it may be much more challenging in a larger authority to truly work in a truly integrated, joined up way. And some of this can be purely because of the size and the amount of personnel, but also because of the different areas and the needs of those different areas. So I think it's really understanding your population, the needs of that population, and how you can best work together to integrate those services to meet those needs. Next, please. So areas that we feel are ripe for joint commissioning. Joint service reviews and service pathways. This can enable those person-centred outcomes with a focus on a need. You can have that service user involvement to review those services and the pathways. It enables a consistency across the pathways and also in those reviews, which also then will enable you to forecast that future need and have that joined up approach to identifying what those future needs are. There's an opportunity to have joint funded programmes with schools and in the education system. So some examples of these would be we have locally developed an outreach service for social and emotional mental health, and also with the online counselling services such as My Happy Mind and COOF. And these are joint funded between health and education to look at those lower level needs, that early intervention to provide children and young people with that early support. Within the SEMH system, so alongside that joint funded programme with school, those counselling services are also part of this system, but also we've been looking at the disordered eating and that early support for those children that that are presenting with some sort of disordered eating, and also around self-harm support. And we're developing a service again along with schools and our social care colleagues around providing education and support for parents, but also for young people to access some online systems around support around self-harm. And complex care commissioning. So within this sort of micro commissioning, this is around that personalisation, around personal health budgets, personalisation of care, joined up and integrated specifications and processes, and joined up procurement. So not necessarily sharing the budget, to actually to look at how we can do this jointly to really improve those outcomes. Sorry, I just lost my train of thought completely for a moment there, so I do apologise. Yes, so to look at that joint integration and specification and procurement to see how we can work more effectively to meet that micro commissioning need, which we also hope will help us to have that innovation within the care market and the opportunity to grow. Now, we know not just in the care market, but across the whole health system, there is a real issue with staffing and with recruitment and retention. So we're hoping by starting small with this sort of micro commissioning and working on how we work together to commission this and to develop that innovation in the market, is that it will help us to inform those wider and bigger projects to look at that wider workforce development and workforce retention and recruitment. Next slide, please. Some areas of joint commission in Portsmouth. So workforce development, this is a delivery of a coordinated system-wide SEND and SEMH workforce development programme, and a platform that will identify priority areas for workforce recruitment and to work with partners to develop an innovative programme for recruitment and retention. For SEMH Pathway, as we've mentioned, we have the online counselling service, COOF, for 11 to 25-year-olds, the My Happy Mind, which we're currently working on, which will be introduced early next year, which is for primary school age children. We have the Autism in Schools project, which is a school-based training programme to improve inclusion and engagement and understanding, and to reduce our exclusion rates in the city. Also, as I mentioned before, looking at a training programme for body image and disordered eating, and also that self-harm support service. With the ND pathways, so we're very proud of the Portsmouth ND strategy. I won't go into that too much detail, but if you do want more information on that, please do email me. And there are lots of authorities that have expressed an interest, and we will share further information on that if anybody would like to know. And as I say, the ND pathway was to enable identification of difference and diversity, to establish that early help response to neurodiversity, and enable and empower children and their families to understand diversity, and really to get that right resource in place at the right time, that right support in place at the right time, directed to the needs of the child, and also to have evidence-based resources to back that up. And as I mentioned before, the complex care commissioning, so around that personalised planning, streamlining processes, growing the market, having good quality monitoring, and really having that very high level of service user involvement and quality assurance with the service users' involvement in that. And short breaks is the next one, which is to look at that personalisation, to give more choice, to grow the universal offer. So we're trying to look at what's going on locally within our community that we can actually develop with our community partners, and then also to improve that inclusion within the city, within our universal offer and our community providers, as well as that more right the way down to that more specialist play scheme and specialist services tailored to meet those children with particular complex needs. Next slide. Thank you. So what have we learned? Tenacity, don't give up. It does take a long time. I know I've mentioned time, but I think time really is the key, and I know time is extremely precious, but I think all the while with anything we're doing, if we can look at building those relationships, build trust, develop and own that narrative. As I said previously, the ND strategy conversation started about 10 years ago. Development started about 5 years ago, and Pathway was fully introduced on the 1st of September this year. So that's been across the whole service, right the way from senior management to practitioners, to really get everybody involved. And we really did start with our service users and a blank sheet to say what would meet the needs of your children and young people. And our profiling tool came from a lot of that work with our service users. So we're very proud of that, but it has been a lot of work to get to that point. So time, relationship building, define and manage that narrative, and keep chipping away at it. There will be conflict, there will be pushback, and the thing is with conflict and pushback is that you can use this to your advantage, because that does mean that people still have passion and drive and have an opinion and want to make a difference. So therefore you can tap into that, and by identifying what their priorities are, by really understanding the service users and population, having that relational practice, and be realistic about time and effort it needs to make a change. You can start chipping away at it and making that change. So I think the tenacity and the time are the two key points to this: of don't give up, find the opportunities, be curious, accept that you'll have a time frame that probably will need to shift and change, but be realistic about what you're doing, and absolutely appreciate that we still have to meet those KPIs, those national directors. You know, there's everything out there that is pushing us to do what we need to do, but at the core part of this, it's those children and young people, and really looking at their aspirations And so, sorry, so I've just noticed something just popped up around the narrative. So around the narrative is really understand what your project is, know your story and stick to your story. So this is our outcome for our children. This is a journey that they would take. We found that pathway mapping really helps with understanding that narrative. Service user feedback, hearing the voice of the child, so finding out exactly what that experience has been like, what would make a difference within that, then developing your story around where we are going with this and why we are doing it, and being really strong with that, because we have lots of strong personalities that we work with, and lots of as I say, lots of different pressures because of our different reporting structures, our different ways of working, is pulling together to actually say, well, this is what our service user needs are. These are the outcomes we wish to achieve for our children. This is our budget constraints within this. How can we explore and do this differently to meet that need? Okay, next slide, please. So in summary, I feel this has been really quite a quick jaunt through. And as I started sort of doing this, I kept putting things in and taking things out, and realised that I've learned a huge amount in the past 20 months around commissioning, which I really had very limited information on and very limited knowledge of before. And there's still so much more that I need to learn. As I say, as a DCO, I think I'm in a really fortunate position to have the opportunity to build those relationships and be that sort of conduit between the different services to enable them to have those conversations, to be that curious person, to be that voice for our children and our families, and to really understand what our service users need. As I said before, it takes a lot of time and effort to really make progress with this, but I think the rewards long term are going to be huge, but it's going to take a long time to get to that point. And we certainly haven't got everything right, and we're certainly nowhere near where we want to be, but we are proud of where we've got to so far. It's so important to focus on outcomes, the so what, that lived experience. As I said before, own the narrative, understand your processes, pathways, understand that real lived experience, and feed that into your narrative, to the story that you're telling, and why we're doing this. So when there's those periods of time we get lost along the way, if you can focus on what we're aiming to achieve at the end of it, it helps people to come back into why we're doing it. There will be conflict, as I said before. Try to move this forward. Try to use this to move things forward. Use that passion. Find out what their perspective is, and use that to move forward and not to stall that progress. Working this way, we hope, would increase that project saving and improve performance long term, and help to, build that resilience within systems. You need to be bold, brave, and challenge that status quo. And as I say, with any of this joint commissioning, truly integrated commissioning, from my limited experience so far, it's not a quick fix, and it will take time to get there. But I think it is absolutely worth it in such challenging and difficult times to be able to reduce that pressure within the systems by doing things differently. There's going to be, we know there's rising demands in certain areas, so we want to improve that quality and efficiency, and to have that accountability around that, both that quantitative and qualitative data. So, how are we doing things? What's the so what and the lived experience of that child? Are we meeting their outcomes? And are we truly aspirational for our children and young people? Yes, that's a summary. And as I say, that was a very quick jaunt of my personal experience. And I appreciate there's lots of things that I'm still learning, and I can learn from all of you. So I'm really interested to hear all of that.
Thank you so much, Tracy.
Thank you.
Perfectly to time as well. So we do have time for questions. And I've picked up a few questions in the chat, so I'll just read those back to you. And if anyone else has another question, just pop your hand up. So from Lorraine, thinking about the change to integrated care board level, what does that mean for your section 75? So will you extend that to the other local authorities that are within the ICB patch?
So at the moment, no, it is Portsmouth based. They are looking to longer term to expand that. It's just being the ICB Section 75 is just in the process of being rewritten in Portsmouth, so it's just having those adaptations to meet the need in the ICB. We moved into the ICB in July, so it is all very, very new for us. So locally we have that Section 75. Southampton have a Section 75 with their local authority, and then the Hampshire and Isle of Wight have a slightly different take on things, which I'm not going to pretend to know or understand at the moment. But I know there are conversations that are being held around how we can make this ICB wide and more, more effective across the system.
Thank you. Yeah, we're still learning in relation to ICBs, aren't we?
Absolutely.
Another question from Louise, which was around the Parent Care Forum and how they're involved in that commissioning process.
So we have a very active local Parent Care Forum, Portsmouth Parent Voice, and we invite them to, as much as we can, any when I say co-production, we would love to, I think as all of us would, have that blank sheet. As I said, we were very fortunate with the neurodiversity and looking at that originally, to have that sort of blank sheet around what is it that you would like. We knew we still had our constraints within the service to look at as to what we could do to meet that need, and that's where we would like to be with every project, but we need to recognise that co-production is at varying levels, and that we need to be conscious of the fact. So what we aim to do is that we invite them along they are very much they lead on our Autism in Schools project. They, as I say, they have been very involved, and they are involved even in the workforce development and training sessions around our neurodiversity platform. So we have direct links in with that, the parent forum, but also with our the wider parent forums. So that's a parent forum for children with SEND, and then we have the parent forum that we also have links into. We have a SEND strategy, and all of these groups also feed into our SEND strategy in those groups, so they come along and attend those, and then we work together on projects. So it's at varying levels on that co-production scale as to how much involvement and engagement, depending on the project, where we are within the project, and also availability, because we know parental time is precious. So we try to involve them at all levels so that we're not missing that opportunity.
Thanks, Tracy. And I'm going to come to Emma, who has her hand up. Emma, what's your question?
Oh, hi, Tracy. Thank you for that. It was really interesting. Just a quick one, really. I probably should polish my listening skills up a bit, but just for clarification, is your Section 75 covering your integrated commissioning team? Is that what it's covering?
So it covers across our local authority, our integrated commissioning team, and across to our health provider.
Okay. To deliver.
So it's I'm not, Emma, if I can take that one away, because what I don't want to do, because I hadn't sort of prepped myself, so I haven't got all the details on Section 75, but if I can take that question away, and I'll
yes, please.
Is that all right?
Yeah, thank you.
What I don't want to do is give you the wrong information, because I've muddled it up in my head this morning. So if I can take that question away, and I can come back to you with a really clear explanation as to exactly what the 75 is currently covering.
Yeah, no problem. Thank you.
Tracy, we can help with that. CDC will take a couple of actions away as well, so we can follow up with you on that. But also, there's lots of interest in your neurodevelopmental pathway, so I think we might.
I thought there might be. I could have spent hours on that, and I thought, no, this is not my place on my bag today for this. But please do. We've had lots of interest from other local authorities, and I know Hayden and Auntie, our head of service, and our associate director have been making contact with those authorities and providing further information. So absolutely more than happy to take that away. And
yeah, we'll follow up with you and write that up if that's helpful for everyone else. We can share it. And Carol, just reflecting on Section 75 being really understood and used in the adult world, but rare in children. So this is an area of great interest.
Okay,
So
I
we'll follow up with
that. So yeah, I've learned something. I wasn't so sure. So yeah, absolutely. I will find out more and share that.
Excellent. And Ian, did you have a question in the chat? I'm just trying to scroll back, but if you are...
it was just around whether, I think you might have answered it. You've got a pool budget and it's through Section 75, is that right? Not through the Children Act?
Sorry, say that again. I'm sorry, I only caught part of it.
Oh, I'm sorry. You
okay.
do have a pool budget, is that right?
We don't have a
Oh.
we don't have a set pooled budget as such
Okay.
across
So
all
this-
areas. So
so
we
it's
have
go on.
yeah, so sorry. So yeah, so the section 75 for our provider healthcare, as far as I know, has that pooled budget to spend, but we don't in complex care, we still have our single budgets. But we work together on that too, and that's just because that's how it works best for us at the moment. So
And
it's not saying that we never would.
And how would you agree percentage splits on individual packages for children then? Is that on a case by case basis, or?
Yes.
So what would be an average health contribution to
That's
to say a resident?
Yeah.
Sorry.
That's right. It's personalised to the children's individual needs. So that would be on an assessment. So it would be a children and young people's continuing care assessment. Do they meet the criteria for continuing care? If they meet the criteria for continuing care, then we would look at what that the percentage would be of contribution from health. We are currently using the CChat for physical disability and the Oxford Matrix for the mental health and autism learning disabilities.
So
and then
so
if
would
they
sorry, go on. So would you, for example, ever jointly fund a child with complex needs, say who was ASC in a residential special school?
Yes, if they met continuing young people's continuing care criteria, absolutely. If
that's
they
a
don't
very
meet
high
criteria,
threshold, though.
it is a very high threshold. If they don't meet criteria, if it can be for us, if it can be clearly identified that they have a health need, so if they're having additional health services over and above the universal health service, so therefore if they have private therapy, so if or there's a therapy provision within the, then we would fund.
I've got it.
Yeah, so
I've got it.
Yeah, we would fund
that was useful. We do have a pool budget, and we're currently having a big audit on ours, and there's potentially a review of the percentage contributions. And I like the phrase above the universal health services. It's one that I'm going to use. So thank you very much.
They might not thank me for that, but yes, it is around that, because it's if the universal specialist services, so if CAM service locally can provide that provision, there would be no contribution from health. But if there is an additional specialist service, so for example, forensic CAMs may be involved, and they may then be providing tailored program for that child, then we would fund, health would make that contribution to that cost, and then would review those care plans and that evidence to ensure that they were meeting the outcome.
Thanks, Tracy. That was a really strong answer and lots of detail. We will follow up on both the Section 75 conversation and the ND
that's not my
pathway.
strong point, so I'm not going to pretend it is. It's more something I know of rather than I've been heavily involved in. So yeah, I can find that out.
We'll follow up and share what comes out of that with the group. I think just Sam had one more question which related to the conversation we were just having, which is around jointly commissioning for complex care packages for children who don't qualify for children's continuing care.
Yes.
Yes.
Yeah, so as I say, we would look at the funding, and if it's over and above the universal or specialist provision that is already provided by health, then that would come through. Or it can be via an individual funding request if there is a clinician, a clinical recommendation that that's a required intervention or assessment. It is a difficult one, and there are lots of conversations, and I think and I think because within that children's within our complex care is that now we've streamlined how our boards report into our high support needs panel. That's really helped with that, or was starting to help with that, but that again, that's a very new thing that we've only just recently introduced.
Fabulous, thank you. Thanks, Tracy. I am going to move us on to the next presentation so that we stick to time, but we'll be keeping an eye on the chat. There's a lot of more than the questions in the chat, so we'll summarise that and write it up and share it as well, because there's lots of related bits of practice from other areas. So, but I'm going to hand over to Jo and Nick from North East and North Cumbria, who are going to talk us through their joint commissioning experience. So very pleased to have you both here.
Hiya, thank you. You're on mute, Jo. there always has to be one, doesn't there? It was me this morning. Apologies. So I'm going to take us through the first couple of slides, and then I'm going to finish the presentation. But just by way of sort of introducing where we are in the world and what we cover. So I am Jo Heaney. I'm Head of Commissioning Strategy and Delivery for Maternity, Perinatal and Children and Young People Services. And Nick was the voice that you heard just a second ago, and Nick is one of the commissioning leads for Children and Young People. We both work within the North East and North Cumbria ICB, and our area that we're responsible for is across the Tees Valley. So just to give you a bit of context at the beginning, so when we're talking about the work that we've done, you can sort of give it a frame of reference. We actually we cover across 5 local authority areas. So when we're looking at joint commissioning, we are often doing it at scale, and at scale being with 5 local authorities. We do things with individual local authorities, but because of our footprint, we try and scale it up where possible. We also cover across 3 acute trusts and 1 big mental health and learning disabilities trust. Just so I'm conscious that there's lots of different people on the call this morning, and some of it may be helpful for yourselves to understand that geography and therefore whether the challenges would be relevant or not for yourselves. So if we move, the other thing just to state from the offset, obviously there's lots of discussion there around Section 75s. The work that we're presenting here is not under Section 75s. We have done this in different ways. We'll come to that detail, but just so that people are clear around that as well. So apologies if this is teaching Granny how to suck eggs, but we thought the first slide, it would be it's appropriate to, I guess, start from the beginning in terms of where the agenda in terms of joint commissioning came from, and to just highlight from our perspective locally the fact that although obviously the Code of Practice first introduced the principle of joint commissioning and the potential benefits of that, it was actually the FIM agenda in 2015 that first supported us to take forward joint commissioning with any great emphasis. That didn't preclude the fact that we were doing joint commissioning for individual children. We were doing that with local authorities, you know, and have been doing that for a significant number of years, but actually trying to do joint commissioning at any sort of scale, it wasn't until Future in Mind came along. Sorry, I used FIM, Future in Mind, which was the emotional health and wellbeing agenda, that there was actually the facility by way of some resource, some neutral money that could be used to try and test the principles of joint commissioning. So it was under that agenda that we were first able to take that forward. I think the other thing to just highlight on this slide is obviously we've got the green paper and the reviews that are currently underway, and from our perspective, the particularly in terms of the additional provision is certainly an area that will support us in future joint commissioning with the potential future joint commissioning, because of the ask that is going to be into schools and the challenges and the pressures that schools are facing in terms of the economic climate. So rather than going into all the detail, because I'm conscious of everyone that's online will be aware of obviously the legislative context. Next slide, please. So this again was just to highlight in a bit more detail around joint commissioning and the principles around joint commissioning and the fact that it is trying to bring the system together to try and use resources more efficiently, more effectively, and to try and take out any duplication, but also to ensure that there isn't any gaps and there isn't assumptions being made across systems and organisations that services are the responsibility of one organisation or another, and therefore what we get is inertia and nobody's doing anything, and we have children and children, young people and families slipping through the middle of that. I think the other thing that is important to highlight is that planning is key, and making sure that everybody is involved in the planning from the off, because if people aren't all in agreement, then there can be a misconception around what is going to be achieved, what isn't going to be achieved, and so therefore the planning aspect is really key. The other things to highlight on here and to sort of localize it from our perspective, if obviously with the code, the aim was to try and streamline and pull budgets and make, because that would make it easier for services to be commissioned, but actually that's something that we haven't got in any of our 5 local authority areas. We have not got pooled budgets. What we have done is, and I won't go into too much detail because Nick's going to pick that up, is that we have made agreements based on different pieces of work that we've taken forward around how and what will be funded within any specific area. It is, prior to us being covering 5 local authorities, we have always interfaced with more than one local authority, which makes that pooling of budgets more challenging from a health perspective, because we can't pool budgets in lots of different local authority areas, but that hasn't precluded us from taking joint commissioning forward. It just makes it a bit more challenging. The other thing to highlight is that we do have across the 5 local areas strategies in place. They vary in terms of whether they're strategies or plans, but we have a shared agreement with each of our local areas as to what joint commissioning means for us and what we are what we agree that we will take forward, and the areas and the priority areas that we want to look at collectively, and that is always based on need within that locality. So that may vary from local authority to local authority, but that is key to get that sign up from boards down into operational delivery, that there is a joint commitment around working together, and within that principle being that we'll assume we can do it together unless we work out that we can't. So that is a principle that we try and apply across all of our areas of work. Next slide, please. So again, this is just highlighting obviously the joint commissioning cycle, and again it's about making sure from our perspective is that whenever we're embarking on a piece of work, particularly when we're looking at jointly commissioning a piece of work, is that all partners need to be in from the beginning, because we need to ensure that whether that's ourselves, local authorities, ourselves and a school, or ourselves in a cluster of schools, we need to ensure that we're all looking at the same problem and trying to find a solution for the same problem. We also need to be really clear that we know what the outcomes are, we know what outcomes we're trying to achieve, and we can build that into what specification we're developing, and we can also make sure that we have got the mechanisms to measure that. We have done some learning around not necessarily always capturing the outcomes that will meet everybody's, satisfy everybody's agenda. So that would be something that I think is really important to flag at this point, is making sure that the outcomes that we're hoping to achieve from any joint adventure is there from the off, and we build that in. It's also important to state, I think, that I know it was asked in the last presentation around engagement with Parent Carer Forum. We engage with all 5 of ours. They're involved with every step of the way. We bring them together as forums across the patch where we need to, If we're doing a piece of work across the 5 local authorities and ourselves, we will seek representation from each of them. They often will put forward a local authority, a parent carer forum to represent the other forums. We work it through in terms of where best. We do that also with any appointments. So I've recently just interviewed and appointed a new DCO. We had agreement that one of our parent care forum reps would sit on the panel, as well as one of our local authority reps. So they are completely they're embedded. We don't really use the term co-produce. It's just what we do. It's just part of what we do. They're just involved from strategy, from reviewing. They're our critical friend. They tell us when we think if we think we're getting it right and we're not. So they are completely involved in every step of the way, and they do review jointly commissioned services with us to make sure that, like I say, we're getting it right. Or the service is delivering what we thought it was going to deliver. Next slide, please. So in terms of our approach, it's got different elements to it, but I think key, and it was mentioned, Tracy mentioned it in the last presentation, relationships is key, and I think that is where the time comes from. You cannot underestimate. We did at our peril in the first couple of years of trying to jointly commission. We thought we could do it all and have it all sorted within a year. We couldn't, because the relationship part takes time. You've got to build trust, and you've got to demonstrate that you will do what you say you're going to do, and that takes time. So the way we tried to do that with certainly our schools in the first instance is we went to them and asked them, what are we doing well? What aren't we doing so well? Tell us where we're not getting it right, and we'll see how we can try and fix some of that for you. So trying to, like I say, do a bit of that building of relationships, and demonstrate by responding to the things that we aren't doing well and addressing that quickly, so that they know that we're good. We do what we say we're going to do. And that is really important. And also schools in terms of head teachers, but also SENCOs. We certainly, again, I won't go into too much detail, but we attend lots of SENCO meetings, SENCO briefings, to continue to keep that relationship and allow that dialogue two-way, so they can tell us when things aren't working, and we can be able to respond to them, or we can clearly articulate why something is proving to be more challenging than we expected it to be. From a local authority perspective, one of the things we did very early on and continue to do is literally sit round a table and work out what's on everyone's priority list, and look for that, where we've got crossover, and also look at what things are challenging.
Listen to the end of this presentation.
So what things are challenging us. Are challenging us also in terms of where some of the noise might be coming from in terms of waiting times, but also being transparent and sharing around where we've got pressure points, and also some of the areas where we know that we're getting some feedback from different parts of the system in terms of pathways we might want to look at and review. It's also really important in terms of understanding the governance and the decision-making processes, particularly important when you're covering across more than one local authority. We have 5, they all work very differently, their governance is very different, and therefore we need to make sure that we factor that in. That's also the case in terms of obviously schools, and really important when we're thinking about finance, and when different areas are doing their finance rounds. Obviously from a health, we do it April to April. Schools, although go September to September, they are setting their budgets in January, and similar local authority, they all have different, so that's really important to try and make sure that we're factoring all that in. And another thing that is really key, you've got to work in shades of grey. You can't be black and white. There's got to be shades of grey. An approach that I try to take is from all organisations that we're working with on any given time is, where is the organisational red line, and let's work above that, because we all have red lines as organisations. We all are responsive and responsible to and accountable to our organisation, but there's lots of areas of grey that we can work within, and I think if you can stick in that, then that's really helpful. Next slide, please. Over to you, Nick.
We've just got a few slides on different examples of how we've approached joint commissioning and things that we've done. So there's some examples around financial agreements, where we've worked to put financial agreements in place and monetary contributions to services, and then some other examples about pathway improvement in terms of working together on integrated pathways, which is also how we see joint commissioning. So the first example is around mental health and wellbeing, and this is a project that we did in one of our local authority areas as a precursor to the Trailblazer funding. So we bid with a local authority. It was co-produced with the local authority, that local parent carer forum, and some schools. And although it wasn't successful, the model that the schools that were there wanted to continue with it. So we adapted it to put some children's wellbeing practitioners into 11 schools in Darlington. They were the schools that signed up and wanted to work with us as a bit of a pilot. So we had a lot of meetings looking at that costing model, looking at their financial planning rounds, etc., building that service spec and job description really to meet the needs of schools. And we continued to meet monthly with them to make sure that that was going in correctly. Parent carers were part of those meetings so that they were aware of what we were looking at and that model of pushing mental health into schools away from specialist CAMHS really. And then we decided what outcomes we were going to monitor as a system, not just health outcomes, but the impact into education. So over a 12-month period, well, you can see the figures there, 40% of the students were discharged without further treatment. Some of those students were still active in that service, but only 4.5% were referred into specialist CAMHS. So again, that's about looking and making sure we've got that system correct. And one of the biggest benefits of this was actually the CBT that was offered to parent carers as part of this around anxiety and things, and that was actually really well received by parents of children who were struggling with anxiety themselves. Next slide, please. So again, this is another financial agreement between health and the 5 local authorities. So across Tees Valley, we have a needs-led neurodevelopmental pathway, which has been years in the making, started by the huge waits that we had in a particular locality for a diagnosis of autism. So we've done a lot of work with our local authorities in terms of moving to a needs-led approach, and that's underpinned by a multi-agency triage, which triages all referrals coming in with representatives from our mental health trust, the local authority education teams and the early help teams, so that we are triangulating across the system those children who are presenting with neurodevelopmental needs. The output of that triage is now giving us a significant, slightly digressing, giving us a significant strategic oversight in terms of the needs that are coming through. So I think it's reflective over the country, but we know that since COVID, our referrals into neuro have gone up by 300%. So we are now working through those referrals, but we can see that a high percentage of those children don't get onto that specialist pathway because they're presenting with other needs such as trauma and attachment. So they're new pathways that we're working on, again, as a system. So that again will fall into our joint commissioning work streams. But we are collecting that data and working as a system to continually improve and shift that pathway because it's currently flooded. But to underpin that pathway and all the work that we've done, we've jointly commissioned a family support service for children and young people with neurodevelopmental needs. So no diagnosis is needed. That was born out of consultation with parent carers across the 5 areas who advised us that there was no support whilst on that waiting list. So that's what we moved to put in place. We developed a service specification based on work that was previously started in St Helens that was seen as best practice. I can see that Julie's on the call, so just acknowledging that we did take some of their work and utilised it and tweaked it to meet the needs of parents up in the Tees Valley. That was tweaked with parent carers and the local authorities. We funded it first with 2 local authority areas, and as of December last year, that's gone over the 5 local authority areas. So based on the size, that was how the local authorities determined their contribution, and therefore the delivery into those 5 areas was then prorated, so to speak, based on contribution, and the ICB contribution was then divvied up based on children and young people population, just to try and get some even split on that. We monitor that quarterly with we do it 5 times with each local authority and parent carer forum, ourselves and the provider, looking at that, looking at the model, tweaking it. So we keep looking at that model because we've got multi-agency drop-ins, peer support, but we've got to make that work and fit the locality. So parent carer forums are heavily involved in that in terms of where those drop-ins run out of. And the themes we monitor from each locality so that they can tailor parent training sessions accordingly. So you can see there in less than a year, we've had over 4,500 families across the Tees Valley accessing support from this service. Next slide, please. This is an example of where health and education have moved to commissioner service together, where the education setting couldn't recruit an occupational therapist that they were looking to recruit, so approached ourselves to look to see what they could purchase off the NHS, really, in terms of that occupational offer. We looked at that with the individual school and ourselves, and also the parent carer forum and the local authority from the area were also involved in those conversations, so that we could have a strategic oversight and set some outcomes that was benefited everybody, really. This has been an absolutely brilliant pilot, and the school are chuffed to bits with it, to the fact that it's rolling out into the other schools within their MAT. So the outcomes that they're seeing for their children and their reduction in their behaviour logs, it has been outstanding, really, to the fact that it was a pilot for a year, and now they've just from September just entered into a 2-year contract with the relevant foundation trust. So it's showing brilliant outcomes. Parents are benefiting in terms of understanding their children's needs more, attending training sessions, and it's been really, really positive. And some of the outcomes are on that slide there in terms of, you know, the outcomes that have been achieved for individual children. Next slide, please. This is more of an example around joint working. So we have put a Tees Valley sleep service in place for children with additional needs across the Tees Valley. The ICB accessed some funding and worked with the local authority 0 to 19 teams and the family support provider to have practitioners trained up in Sleep Scotland to be able to co-deliver sleep workshops. Again, a number of meetings with those 0 to 19 teams and the commissioning leads from the local authority. We had all the parent carer forums were involved in this. They designed the website with the provider, and that's just launched in October. We ran through the presentation first with a group of parent carer volunteers, and tweaked it based on what their response was to it. So again, I guess this isn't more of the training's been delivered. We do have a steering group in place to keep that going and to make sure that the 5 areas are working the same, so that we get that consistency delivery, and we've got outcomes allocated against this project to be able to monitor the impact and the different tiers of the system that parents need to access depending on the needs. So those reporting metrics are all in place, so we'll be able to start producing on them from December onwards. Next slide, please. These are examples of, again, joint working between ourselves and the local authorities across South Tees, which is 2 of our local authority areas. We do have a jointly commissioned specialist SALT
So just in terms of some of the lessons learned is, and to just sort of wrap up our presentation, key is absolutely understanding. You need to understand what the needs are within the system, and to be doing that in a strategic way pays dividends in the end, because what we've been able to do is join up a number of these what would be quite disparate pieces of work and bringing them together to get a real benefit for children and young people, particularly for those children and families coming through from an autism perspective. Nick's just obviously mentioned the key worker element there, that and the link to the DSR. We were able to do that because the team has that oversight of it all. So I think that's really key. It was mentioned previously by Tracy, and I've mentioned it. Do not underestimate the time it takes to negotiate and build relationships, and start from a place of mutual agreement. I always bring it back to what we're trying to achieve is children achieving their potential. How do we do that together? And that tends to centre people and allow conversation to flow. Learning the language, that was key for us. We needed to be able to speak education so that we could translate what we were meaning by our outcomes to an education outcome or a local authority, social care, whatever, you know, so that people could understand what it meant for them what it means for them in their world, which has allowed us to build and build and build and do more and more work. Schools is really key. They are more of our natural commissioners from a health perspective than local authority because of the resources that they hold. I think that I alluded to it in the first slide. That is going to be even more important with the squeeze that's happening currently into education and the reduction in their finances. But with that brings opportunities because they're still going to need that support. There's a real key focus on, particularly around speech language communication coming down from the DFE. Therein lies an opportunity to say, let's do it, use your resource differently, we can do it together, would be sort of my approach from that. We mentioned around parent carers partners, we don't do anything in isolation, we do it all as a system, and that allows us to move things forward really, and they don't let us. not that we ever forget them. Like I say, it's just what we do now. We don't need to think about co-producing. We just do it. We have such good relationships with them that they wouldn't allow us to get away with anything, or if they got a whiff of anything, they would be flagging it to us. I mentioned about the outcomes, really important. Make sure that outcomes are representing all sectors that are working together. Otherwise, there can obviously be frustration, and not just frustration, but then it may be more challenging to have a continued joint arrangement if we're not able to demonstrate the impact across the whole system. Be honest, be transparent, be really clear about what money there is and there isn't, and what is on the table, what isn't on the table. Like I said, what's the red line, where's the areas that are grey, and work in those areas, because that's where you can really transform. Don't be put off by, from a school's perspective, if there's only one school that wants to do something, find a way to do something with one school or one local authority. In our sense, if there's, you know, it depending on how many areas you cover across, use it as an opportunity to test a concept and then share that concept, and it might go bigger. But no, as long as there's two of you, you're jointly doing something, would be my view. And if it's going to meet a need, then it's worth taking forward. The other thing I would just to add, or to wrap up from us, is that over time we've had to move from the very purist view of joint commissioning, in that we are buying services and reprocuring services. It's not realistic or appropriate to be doing that continuously, because we just destabilise systems all the time. Therefore, we moved along with our partners to a place of what we mean by that, and that is that we can jointly review services, we can look at opportunities to integrate pathways, and we can review the effectiveness of services and tweak services without the need to reprocure or commission them. It's resource intensive. It doesn't necessarily always mean you'll get what you want, but as long as you as a system have that openness and transparency in the way you work together, in an inclusive way, then you can still transform and jointly work together to improve the outcomes for children and young people within your localities. And that's it. I'm not sure if we've gone over time, so apologies.
Yeah, no, we absolutely have 5 minutes. Emma, we will come to you in 5 minutes if that's all right. We have time for some questions. There's a couple in the chat that are similar, so I'll just summarise. And I think it probably related to the OT service. So it's that how it works really with schools purchasing services direct from a provider, and how does that sit with waiting lists for the same service within the area?
So what we've done is we actually use our contracted service. So the school becomes, we do it on their behalf. So they piggyback onto our service basically, and it doesn't affect the waiting lists, because it is a joint. They have directly commissioned a specific specification that's been developed between the school and the service to meet that need, and they pay for that provision.
Thank you. And lots of reflections that that was a really good articulation of what joint commissioning means in your context, the context of your system. I think that was back to my point at the start, that joint commissioning isn't really one thing, is it? It's a catch-all for lots. So yeah, any other questions, pop your hand up, come off mute. We have a couple of minutes before we move on to Emma's presentation. Questions or reflections? I can see lots of people in the chat agreeing with lots of the points, particularly around language. Emma, come in.
Oh, hi. I don't know whether you're summarising the chat queries, Anna, or not.
Yeah, we'll do that afterwards. We'll send you a summary of what, because there's lots more than questions in there. So yeah, you will get a summary of that.
I was just selfishly going to say.
No, I can see there's a few requests for things. So if you've offered to share a spec, and I know there were a couple of people that said they would, if you're happy to share that with CDC, then we can pull together a pack and just share with the wider group, so you're not getting requests all over the place. So yeah, send anything to us.
I think it's just to understand if it's the family support spec that people were asking for.
I think it was family support, yeah. And I know that Heather has offered to share something too. So if you share that with us, Heather, we'll share it onwards. All right then, Emma, we'll hand over to you. Mary will share your slides. Just let us know when you want us to move on. Thanks, Jo and Nick as well.
Thanks, Mary. Okay, hi everybody. I'm Emma Lonsdale. I work for North Yorkshire County Council as the Head of Service for Children, Young People and Inclusion. And I guess I'm going to repeat some of the messages that we've heard, but probably worth again emphasising them in the context of North Yorkshire. So this slide is a little bit about the context of North Yorkshire. So we in North Yorkshire have a population of around about 160,000 0 to 25s, and most recently we were working with 6 CCGs. That's now flipped to 3 ICBs, and a plethora of providers. I think one of the most shocking things that I soon came to realise when I first started my first job in the first week in North Yorkshire was to review the 0 to 5 service. I thought, right, tell me who your maternity provider is. Oh, there's 6 of them. So I think there is something about the complexity of the geography in terms of its rurality, market towns, coastal towns, alongside some of the partnerships. Thanks. Would it next slide, please? In terms of our journey, I just wanted to highlight some of our key milestones in terms of I guess my first challenge. I came into Portsmouth in 2015, and quite quickly in the summer of 2016 we were one of the first areas in the first tranches of the joint send inspections, and I remember my colleagues very quickly learnt that I used to be a joint commissioner in a previous post across County Durham, Darlington and Tees. So I was cited as the lead for the joint commissioning workshop and had a really uncomfortable time, challenging time with the inspectors, trying to sort of drag off the bottom of the barrel some examples of joint commissioning based on what I felt the inspectors' interpretation of joint commissioning was, which was joint investment. They wanted to know where areas we had joint invested, and because I was quite familiar with the Future in Mind agenda, again, as Jo mentioned at the time, we were trying to describe the partnership and how we were coming together, we were aligning commissioning, and it wasn't really cutting the mustard. So then we came up with this sort of really uncomfortable example of this piece of complex equipment we'd jointly invested in, but I think it gave us some real lessons to learn about what we thought joint commissioning was and what the inspectors were looking for. To just press the button again for me. So as I say, for us, Future in Mind was a real good opportunity to come together. I guess there was 49 recommendations. There was a big list to work on. I think the funding for us was a bit mute, really, because NHS England had put it into CCG baselines. Not all CCGs for us locally released the full amount, so it really became about the partnership. And in 2017, we sat down together. Although it was CCG monies, wrote a spec together, did a joint procurement, sitting around the table together, did the evaluation together, and it gave us a real strength in terms of some of those key ingredients around partnership working. Next point. We then later on in that year did an autism pathway project, which I think was a real key turning point in terms of parental involvement. So what we wanted to do was learn which were some of the things that were going well in the autism pathway, which some of the things that weren't going too well, not just in terms of the health pathway diagnosis, but the support that was given from an education and care perspective as well. And the stance that we took was we weren't going to have a parent workshop, a professionals workshop. We all sat in the room together and we went round all of the districts and had a real joined up conversation. I think it felt really safe to have parents in the room. We were willing to hear the good, the bad, and the ugly. So that was quite a turning point in terms of our co-production journey. Next point. Then we had some DCOs. We may have been a bit later to the party, but we didn't have a formal DMO in terms of the sort of post pre-legislation hangover of the education lead paediatrician. But the DCO roles were quite revolutionary in that we had that consistent health voice, whether it be around individual education, health and care plans, packages, that real challenge in the system. It was quite a pivotal moment for us in North Yorkshire. And then highlighted in red there was our very sort of next, I would say, strongest catalyst for change around joint commissioning. We carried out a maturity matrix. We stripped legislation back, the code, looked at all of the points in the code of practice around joint commissioning, managed to get everybody at County Hall, which is no mean feat when it's an hour and a half away from Craven one side, an hour and a half away from Scarborough the other. So all of our CCGs at the time were represented there, education and care. And we had a really honest conversation about where we were on some of these joint commissioning things that the Code of Practice told us to do. And it gave us a real action plan for moving forward. And that was February 2020, and sort of lo and behold, COVID then hit the next month and lockdown happened, which actually, in terms of our joint commissioning journey, probably facilitated a change in the way we delivered our relationship. Everything went on Teams. It meant that, you know, if you were a Bradford District Craven representative, you could come to the meeting because you weren't travelling for 2 hours to get here. We then had, as I say, a really strong action plan. One of the first, we went back to all of our CCG executives and our HAS and CYPLT executives as well to remind them of what the joint commissioning duties were. I think there'd been lots of papers that had happened at the time of the legislation after the inspection, but this was a key reminder to get everybody back on board. We then started from, I guess, the top of the joint commissioning cycle in terms of understanding need. We used the recommended data set within the Code of Practice as a starter. And the first iteration of the JSNA was published in 2021, which gave us some key messages and areas of development that we needed to work on. We then had I guess, an example of a piece of joint investment, whereas the SEND-IAS recommendation for joint investment had never really been on the table. And during COVID, there was time to have that conversation, think about what the reasons were for why CCGs might want to invest in SEND-IAS. And lo and behold, there was some monies on the table. Another part of our journey, which I'll talk about a bit more in detail, was our emotional wellbeing section 75, which was introduced just this year with a pooled budget and a service going live in the 1st of April. I'll tell you a little bit more about that later on. And then we really compartmentalised all of the priorities that were standing out for us in the SEND JSNA, the things that we knew were must-dos in terms of those gaps we'd identified in the maturity matrix, and have developed, not published yet, a joint commissioning statement and plan, which has in principle been signed off by Children's Services and is just doing the rounds within the, I guess, emerging ICB governance. Next slide. Some of our challenges, as I say, is definitely our geography. Some of the needs of our children and people are dictated. I'm just going to wave because the light's going to dictated by their reach, their access to services, and as I say, based on relationships with other commissioners, providers. It's just that the sheer distance has been improved much by access to Teams and Zoom meetings. I think the people have mentioned a common language. You know, people would say, when I go in them health meetings, I have no idea what they're talking about. And as Jo said, we go in them education, we have no idea what they're talking about. And it was a real key thing for us to just take some time to understand each other's positions, check ourselves. When I was going through the joint commissioning statement and plan with the chair of our parent care advice, she'd say, "Oh, Emma, what does that mean?" So it was quite challenging that I had to change sentences. So I thought, yeah, why am I talking like that? Why not just say it as it is? So I'm sure there'll still be bits in there that seem complex, but we really tried to give it the town hall test. I think we have to recognise complexity of budgets. A lot of North Yorkshire's, particularly from our health colleagues' perspective, are tied up in sort of real old long-standing contracts that are probably blended within providers. It's difficult to disaggregate budget lines against particular services, which in terms of joint commissioning has given us some difficulties really. And that's, as you know, as Jo said, it's about starting out with what we can work on. Relationships, I think, are much stronger now than they were sort of pre-COVID. We have determined not just commissioning relationships but provider relationships as well. Our parent care advice had a revamp. Our young people's participation team had a revamp. You know, we're talking to parent carers and children, young people much more than we ever were before. Next slide, please. So our current context is that the health partners prioritise working through the maturity matrix, and we developed a joint commissioning group. The group itself has such a wide range of representation and a consistent representation, which for me was really surprising, particularly during COVID, because we'd switched to a virtual way of meeting. It meant that our Bradford and Craven, Scarborough colleagues were consistently there, you know, at a time when it would have been quite easy to put your apologies in because of the challenges that and the you know, the capacity that people had. So that sort of told me that there was a real strength of commitment. We had a CDC facilitated workshop back in November 21. So next week, probably next week will be a year ago, which again was another catalyst for us. It was to kickstart developing our joint commissioning statement and plan. And you know, we got together, we spent some time having a real detailed conversation about what was our what did we mean by joint commissioning. We did an activity where we went right round the joint commissioning cycle, and we came up with a definition, you know, which states our interpretation of joint commissioning extends beyond joint funding, and that we recognise all aspects of the joint commissioning cycle, and that we will work to that joint commissioning cycle. And I think if I was in a room with an inspector again, which we probably will be at some point in the future, I can give it when I think it was Tracy that mentioned narrative, we can give that real narrative about what our definition of joint commissioning is, and it's shared. That's something that I would say that a commissioner from Cumbria, North Yorkshire would say, that a place commissioner from Bradford District and Craven would say. So it's a real strong definition. Next slide. So just to go through the process, we used the joint commissioning cycle and went, come on, let's give some examples. So we talked about the JSNA, the engagement with the parent carer voice. In terms of joint planning, we talked about our emotional wellbeing offer, our strategy that we have, our key children's plan, which has been Young in Yorkshire. We talked about the joint delivery and training we have around our sleep service offer, our early language development, school readiness pilot, again, emotional wellbeing, which is a real strong theme because it's, again, like Jo said, it's one of those wicked issues. Our autism work in terms of joint reviewing pathways. We've joint reviewed speech and language, and again, broader mental health. So I think it's important to say that joint commissioning cycle is a cycle which you can go through all of the stages, but you might pick off a stage, you might go back round it, you know. I think it's not a linear thing. Next slide, please. What you see here is our partnership pledge, which we have with our parent carer voice in relation to how we're going to work together. So we have worked with the parent carer voice, with Zendayas, and developed these key values. But I guess the next stage for us is putting them into practice, and right through the priorities that we've published or will publish within the statement of plan is to make sure that we are co-producing, or as closely co-producing as we can, and that we have a you said, not we did, but a you said we did together approach. So it's a really important aspect of what we want to make better. Next slide, please. Other developments that we've got in the offing, again, based on some of that must-dos, is around uptake of personal budgets. I think at the very beginning of the legislation, there was a real emphasis on personal budgets. There was the legislative, requirement, right to request, and now's the time to really refresh and reflect on, how clear are we about what the offer is. And that's a project that's ongoing at the moment. A really interesting one, I won't labour any of the other ones, I'm assuming that some of those are ones that you're all grappling with as well, is the dispute resolution process. It's really interesting that the Code of Practice talks about dispute resolution, and that then automatically becomes about disputes that parents, families, children, young people have in terms of either the education, health and care process, or complaints about particular services, experiences that they've had. But there's a part of the Code of Practice that talks about having arrangements for disputes between local authorities, CCGs and partners, and we recognise that as a gap in the maturity matrix, and we've only just come this year to sort of nailing what that's going to be. And I think in terms of pieces of work, I don't mind admitting, what you usually do is you go looking at your neighbouring authorities, you have a bit of a Google, see what's out there. And there just isn't any, there really isn't. I think a plea here, if anybody's got one, it would be great. But at the moment, the process that we're taking is we're going really back to basics. We're talking to some of the panels that sit or feed our exceptional placement panel that talks about the complex joint packages, asking them about where are the key areas that they think there may be disputes. There is, and some of the examples are where there are particular specialist assessments where they're not quite sure how to challenge because it's not their area. I think, Ian, you talked about how packages percentage splits are determined. I think some of that doesn't fit well sometimes. So it's a real key piece of work for us so that we can give staff understanding what one another's role as, so there's a clear set of expectations, and that we do have a form of process where people can escalate things without it being a challenge to strong relationships. Okay, next slide. So a joint commission entail, as Jo said, we had future in mind, published March 2015, 49 recommendations, a real challenge for strategic partnerships to improve the emotional wellbeing offer. So in 2015, the local authority had recently commissioned a service, an organisational called Compass, to deliver low-level emotional wellbeing interventions, and the project was called REACH. And then Future of Mind monies went into the baseline for CCGs, and again, you know, one of the gaps that we decided through looking at the data, talking to other professionals and stakeholders, that early intervention was a big space of demand. So there was an opportunity to, as I say, sit down and not jointly commission, but align the commissioning, thinking about what the local offers were that the local authority had commissioned alongside, helping to devise a specification, sit through the procurement process that the CCGs were going through, and doing that together, which was a fairly new experience. Then in 2020, and purposely in 2017, we lined up the end of our contracts because we felt there was an opportunity, could be an opportunity to joint commission. We went through a fairly robust consultation process, and we concluded that it would be best to join up this funding, and that we would develop a joint commission agreement to do that. We landed on a Section 75 because we felt it gave us the most efficient and legally safe way to develop the agreement. We identified our CCG as the lead commissioner, which, going back to 2015, we might not have done that, but relationships are so strong at the moment that there is lots of trust. That's fine. We have a joint commissioning group that oversees that agreement. And as I say, there, after many ups and downs, the Section 75 was enacted on the 1st of April, and we have a joint service which we did. There was a procurement exercise, and Compass, the organisation, was successful in gaining that again. Next slide. So I guess, as others have done, just to round up, senior leader sign up is one of those key ingredients, and as I say, we went back and reminded everybody what the duties were. Commitment to the agenda, real strong commitment to the agenda, and I think I always say there's nothing that motivates people better than budgets and an inspection framework. However, this was, I feel like we're genuinely challenging ourselves about, well, how is this going to make things better for children, young people and families? Taking on a shared responsibility that this is all of our businesses. It's not the local authorities because they hold the lead on send. It is for everybody to be involved in. Again, the common language, as other people have said, both Tracy and Joe said, it was really important that we defined what joint commissioning was, and we gave it a go. We just gave it a go. We now have a robust list of examples of joint commissioning that I think, again, alongside that strong narrative about what our definition is, I think I'm going to feel more comfortable next time we have an inspection. Thank you, everybody.
Thank you, Emma, and I'm sure you should feel more comfortable next time. That's a lot to share. We'll take a couple of minutes for questions or reflections. There are lots of nice comments in the chat, Emma. Go back and read those. Lots of people agreeing and reflecting on things you've said. But any questions specifically for Emma, pop your hand up and I'll see that. Okay, you were very thorough, clearly, and gave us all the detail we needed. All right, I'm going to hand over to my colleague Philippa, who's just going to talk you through a few of some of the CDC resources that we have related to joint commissioning. But obviously, as we've heard from all of our speakers, joint commissioning is all-encompassing. So Philippa will talk you through about resources that we have related to that cycle that was getting a lot of love earlier from someone in the chat. So Philippa, over to you.
Thanks, Anna. Yes, I'm not going to spend very long doing this. There's nothing new here. So if you're hoping to hear of the latest stuff off the CDC press, I haven't got anything additional to share with you. But if you haven't been familiar with these resources or you've forgotten about them, need a bit of a refresher, that's what this is. So I have done it, as Anna said, I've done it around that joint commissioning cycle, because I think it's quite helpful to think about what sort of things might support you at each stage of that. So I'm afraid these slides aren't beautiful or particularly exciting, but the link to each of those documents is here. So I'll just go really quickly through what each of these covers, and then you'll have the slides and you'll be able to go away and read them for yourselves. So starting with that first point around establishing partnerships, the things here are things that we bang on about all the time. So I'm hoping you're familiar with them now, but if you're not, these are the sort of the fundamentals around the work that we do, strengthening those partnerships and strengthening that narrative and that vision that people have mentioned so many times this morning. So our sort of guide to outcomes-based commissioning and the SEND reforms, that's about how do we come together as a system to really establish that shared vision and that shared narrative for our children, young people and families. And that's really the cornerstone of everything. And then we come to thinking about, okay, what we're going to do in order to meet these outcomes, and how can we work together collaboratively? How can we jointly commission in order to get on that journey? So that document, if you haven't looked at it before, really is the sort of the foundation of all of this. The Joint Commissioning Bulletin number 3, catchy title there, is a focus, a bit more detail around that outcomes-based commissioning approach, and a little bit more of the sort of technicality behind it, if you like. So that's the sort of the next stage of reading on that. But the Joint Commissioning Checklist, I think, is a really helpful tool. This is a sort of RAG rating tool that you can go through with colleagues in your local area, with leaders across your different agencies, to think about, do we actually have everything in place yet to really give us that fertile ground for commissioning? So it guides you through sort of the different pillars, if you like, of what supports good quality joint commissioning, and encourages you to think about where you are and having each of those things in place. So there's things around making sure you've got strong relationships and strong mechanics for involving children, young people and parent carers, all the way through to those sort of data sharing elements that lots of people have mentioned today. So that's just something to help guide your thinking and guide those conversations with your colleagues to say, right guys, are we ready to do this? Is there anything we can strengthen? So when we come to actually putting things in action, that we land that more effectively. So that's around establishing partnerships. In terms of that joint understanding, I've doubled this with joint review, because this is really all about the data and what is our narrative, what is the story we're telling on our journey towards joint commissioning. So I've got the 0 to 25 SEND data dashboard there. I'm sure many of you will have heard us speak about that before, but again, if you haven't looked at it, it's a dashboard, as it says, that pulls together the sort of national level 0 to 25 SEND data to help tell the story of your population, your needs, and so on, so that you've got that overarching picture, again, to come together and say, right, let's get a really clear understanding of who we're talking about, where they are, and what their sort of primary needs are. And we've got a lot of additional information about how to sort of go ahead and take that as a foundation for your own local picture, and specialise that a bit more. That sort of goes hand in hand with JSNAs, and I know people have mentioned those before in the business and comments in the chat about them. We did a piece of work a few years ago now, so the sort of analysis, the nuts and bolts of the analysis is probably a little out of date, but what happened was we were invited by colleagues in the east of England to do an analysis of all of the SEND related joint strategic needs assessment, and this was pre-pandemic, so this is probably 2019, and look at strengths, challenges, and areas for development in those documents. But what that helped us to do going through that process was for us to be able to draw out some sort of key recommendations for what a good strategic needs assessment looks like and what it includes. So that document that I've linked to here doesn't have a full breakdown of the different areas. They've got that, and they've done whatever they've done with it, but it's sort of those key themes that have come out of that analysis that you might want to use to strengthen your own JSNA documents, because again, that is that sort of key conversation starter, if you like, to say, right, who have we got, what are we dealing with, how do we come together to support these children and people and families. A bit more on the joint review end of things. We've got a resource here, a sort of briefing around using goals-based measures to gather qualitative data on outcomes. So this is more about getting the voices of those children and young people to tell us actually what does their life look like now? Is the work that we're doing together making a difference in how they're experiencing life? So there are 3 case studies there from different areas who are using different methodologies to aggregate that individual level data up to strategic decision making data to tell us about what their lives look like. And again, that feeds back into that joint understanding. So you can have those collaborative conversations and say, you know, we understand that we're doing pretty well for this cohort. This cohort over here are maybe not feeling as included at school or not feeling as safe or whatever it might be, to again feed into those conversations around that joint understanding. And while none of these things have that sort of direct joint commissioning badge flashing on them, having that clear picture and having those conversations around who have we got, where are we, what are our successes and our challenges, as I think everyone in this presentation so far has mentioned, is really crucial to making sure that you're going on the right path together. Joint planning, various things here. So I've started with our joint commissioning bulletin number 1, which is around those pooling of budgets. That is now out of date now that we've moved from CCGs to ICBs. I've linked it all the same for completion, but I have also linked here to the document, the NHS document that is based on, which has been updated and does highlight where there have been differences with the move to ICBs. So that hopefully can answer some of those questions about that money piece in there. Joint commissioning bulletin number 5. Again, this is a few years old now, but this is thinking about that more sort of individual level joint commissioning, so bringing it down to that individual children and young people. And personal budgets. We've had a few people mention personal budgets today. The last resource I've got here is quite a new one. This came out probably about 6 months ago, which links into some of the points that our speakers have made today about how we involve children, young people and families in that redesign of pathways, not necessarily full recommission, but actually having those conversations and thinking about what is working well, what can we strengthen, and then going on to evidence how we have made changes and what changes those what impact those changes are having for our children, young people and families. So that document again has a couple of case studies in from local areas that talk about how do we establish that vision for this particular pathway or service, how do we work with our families and our children and young people to hear what they want from that service and what the purpose of that service looks like for them, and then again how do we go and get the data to tell us if that change is making a difference. So that's a relatively new one that you can have a look at and use as sort of broad guidelines for going through that process yourself. Joint delivery, I haven't got a huge amount on joint delivery. Again, I've got a bit about personalisation and personal budgets there, but if you have got examples, and we've had some great examples today, if you've got some case studies of where you've really moved forward with this with partners, and you've really not just done the planning and the budget pooling, but you've got things up off the ground and things moving, we would absolutely love to hear from you. We are always looking for more good examples, more case studies of areas that, even if it's not all flashing bells and whistles, but you think actually that's a pretty solid piece of work and something we should rightly be proud of, please do get in touch with us. We're always looking for new case studies, and we're happy to work with you to write those up. So if you've got any examples, please do let me, Anna, or any of the others of the team know. I think that's everything I have.
Thanks, Philippa. That's really helpful. So yeah, we will share the slides immediately after this so that you can get the links to the various resources that Philippa shared. But other than that, I guess all that I'm left to say is thank you to our presenters. I know some of whom have had to leave already, but we really appreciate your time and effort kind of thinking about you know, you've presented this morning, but actually you've done a lot of reflecting on your journey, and that happened before you got to presenting. So thank you for doing that. As Philippa said, we'll follow up where we think there are, well, there are definitely case studies that we want to, or briefings, you know, things that we can write up and we'll share. There is an evaluation link in the chat. Please do complete it, whether this was helpful or not, because we have more of these to do. So if we can make changes and make it more helpful, then let us know via that evaluation form or the QR code. But yeah, thank you all for joining us, and thanks to Miri for making the morning go smoothly, and all our presenters. Thanks so much. Nice to see you all.
Thank you, everyone.
Bye bye.